The agency received a letter of interest from the Open Door Clinic, Community Health Services, requesting to enter into an exclusive right to negotiate on 7.25 acres of the agency-owned property referred to as the Halverson site. The ODCHC, my gosh, that's a lot, has recently received a grant under the Affordable Care Act under the Department of Health and Human Services, Health Resources and Services Administration. The grant provides for nearly $10 million for the construction and outfitting of an approximately 30,000 square foot community health center. The grant was awarded October the 1st and has a 2-year timeline for completion.
We did receive this grant for which we are very excited. What we got along with the grant was a timetable that is clearly developed by bureaucrats who have never built anything themselves, because a 2-year timetable, the announcement came a month after, or almost a month after, the date for the beginning of the project started, October 1st. So finding the right spot became very crucial.
Well, unlike, I guess, one of my other council members, I'm all on board for this. I think this is an awesome plan you have. I went to the site. I looked down on it from the library. I looked down on it from the Samoa Bridge. I kayak every morning. I looked at it from the bay side. That's a great site for it, especially if you design the building to fit with the landscape, and so that the people inside the building are part of the landscape, in other words, windows. I think it would be an amazing project. And my conversations with people out in the community, everybody's just fired up. Ever since anybody heard about this, they went, this is this is the most needed thing this community could put on its wish list, is more medical services for its citizens. So I don't want to do anything to discourage
Nick?
you.
Nick Bravo, Eureka. I think it's a fantastic idea to have the Open Door Health Clinic over where they've suggested. I completely agree with Larry's assessment of it, and that also it needs to be away from traffic, because let's face it, people who are sick, ill, disabled aren't quick enough to get away from cars that might not be paying attention, and we can already see if you ever walk around the courthouse during rush hour, that kind of area on the 101, it's amazing that some people haven't been run over by now. Also, I think that the concern that it might, ruin the looks of the waterfront is a little bit ridiculous. We have a fantastically large waterfront. There's, I'm assuming that the developer or the builder is going to do whatever they need to do to make sure that the building structure on the outside fits with the waterfront. I mean, any competent architect is going to have that in mind. I also think that economically speaking, to have something like a health campus there is going to stimulate the economy in ways that we right now can't really envision. And I think if we look 10, 20, even 30 years into the future, we're going to see that that Eureka could definitely be one of those centers within Northern California that can become very well known for its healthcare. Also, a lot of times I use the Open Door Clinic over in Eureka, and on any given time that I'm there, I see a lot of other people who are from Eureka or McKinleyville or from wherever. It's cramped, it's small, it's not the best place to have to be for medical care, but it's doable. It's a good place. They've got good people there. But to have something like a healthcare campus by the waterfront in Humboldt's largest city would not only add to the reputation of Humboldt County, but increase economic stimulation, and also, like he suggested, if we could train people there, help people learn how to be better healthcare providers, better nurses, etc., then it's going to be a fantastic opportunity to do so. And also, just as Eureka and Humboldt County was known for, lumber back in the 80s or whenever, in 2010 and beyond, Humboldt County can be, if we do it right, can be known for incredibly respected health care at an affordable price. Thank you.
Thank you, Nick.